The Honourable Leader for the New Democratic Party.
On the day following National Suicide Prevention Day, I want to point out to the Premier that if he or I or anyone should find ourselves today overwhelmed, and we should make our way to avail ourselves of the health authorities' community-based mental health services, for example, particularly in Halifax at Bayers Lake, we would be given an appointment to be seen by a clinician in 10, 11, 12 months' time. And so I want to ask the Premier if he will acknowledge that something is deeply out of whack when in our province, from one end to the other, we have people coming forward for help and having to wait 6, 8, 10, 11, 12 months just to get their foot into the door for an appointment.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. This very important, serious question. One of the members from the official opposition read a member statement as well in this House. We know that all of us have been impacted. And it is important that these services are made available across our province. We're working to continue to work with our partners to ensure that we do that. It's also important that we learn to identify the issue very early on in the onsets of mental health challenges that our loved ones are experiencing and our neighbours are experiencing. It's why we've made this investment early on in the education system to make a wraparound services to ensure that we get early detection, because we all know that the earlier we detect these issues, the better the outcomes.
The Honourable Leader of the New Democratic Party.
It is not a matter of what the Premier or the government intends. It is a matter of what the government achieves. The fact of the matter is that today, in Nova Scotia, we have a suicide rate considerably above the national average, while the percentage of our health budget, which is dedicated to mental health, is considerably below the national average, and we have a government which took funds away from Eating Disorders Nova Scotia, Schizophrenia Society of Nova Scotia, and the Canadian Association of Mental Health. So I want to ask the Premier if he can understand why there are a lot of people who feel that his government's record on mental health has fallen far short of what it should be.
The Honourable Premier.
Question, Mr. Speaker. We continue to work with our partners across the province to ensure that we provide the supports that community members need, that family members need. Mr. Speaker, we as a government will continue to do that. I want to assure the honourable member we take the very issue that he's raised here in the House on the floor of the House of Assembly very seriously. The Minister of Health, along with his partners across the executive table, Mr. Speaker, continue to make sure that we have the supports in place. Is there more work to do? Of course there is, Mr. Speaker. There's always ongoing work. And we look forward to continuing to work with those partners to ensure that we continue to provide those supports to our communities.
The Honourable Leader of the New Democratic Party.
Yesterday, suicide prevention advocate Laurel Walker said in an interview at our table that no system, our system is built around Band-Aid solutions and only treating the worst when they have to go to the ER and they're really in a crisis. She said the funding for mental health in Nova Scotia is inadequate. I agree with her. The province is full of people who, on the basis of experience in their own families, agree with her. And I want to ask the Premier if he accepts what Ms. Walker has had to say as a fair characterization, a fair assessment of where we are after 5 years of the Liberal government on the file of mental health.
The Honourable Premier.
Speaker, I think an important part in the honourable member's question was talking about when people would present themselves in our healthcare facilities. What I've said very early on, we need to make sure that we have the supports there and in community-based mental health services. But I think it's equally as important, Mr. Speaker, that we recognize early detection of mental health issues is important for outcomes, important for the individual, and important for families. It's why we continue to make investments so that we can ensure that we can identify these issues early in the onsets with our children and with the wraparound and supports we're providing in the public education system, so we continue to have better outcomes, Mr. Speaker, for all of our families.